views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. I am so pleased to have Dr. Sumir, Sahgal, Sunny, the founder and chief medical officer of Essen Health Care, joining us today on Public Health America. Sunny, great to have you on the show.
Thank you, Dr. Latimer, for inviting me on the show.
My pleasure. So, let's talk about Essen Health. Essen Health has a lot of clinics in the Bronx, and I think some clinics elsewhere. Tell us a little bit about Essen Health.
Absolutely. So Essen Health Care is a multi-specialty group practice, but it works as an integrated network because it has offices, it has an urgent care division, it has a house call division, and it has over 26 specialties, mostly in the Bronx, although some of our offices and some of our operations are outside the Bronx at 5 boroughs.
That's great. Roughly how many clinics do you have in the Bronx?
So we have about 28 offices in the Bronx. Some of them are with next to an urgent care, and we have a few other standalone urgent care centers. So we consider as, where care comes together, where you can go to any location and we will have information about you and take care of you, even if you are in the urgent care or in the office or any other specialties.
So I visited a couple of the clinics in the Bronx, was very impressed, met one of your MDs, met one of your physician assistants. They were both fantastic. Took a little tour, was very impressed. Why don't you give us a little bit of a rundown of some of the specialty care and the range of care that Essen provides in the Bronx?
Well, thank you for visiting, and I appreciate the feedback. We always work as a team. So we have almost every specialty which is needed in an outpatient setting. Our mission is to change the way healthcare is delivered. And the way we want to change healthcare is by keeping people out of the hospital and emergency room. So we have the cardiology, gastroenterology, hematology, oncology, surgery. We have centers of excellence in our healthcare system, which is Women's Health Center, cancer care, pain management, women's, as I mentioned, women's health, and cardiovascular care. So we are one of the few centers that actually do some of the cardiology procedures at an outpatient center rather than in a hospital like angioplasties.
Got it. And is it fair to say you are accepting Medicaid, Medicare, and other third-party payer insurances?
We accept every insurance. We believe in providing care to everybody, including uninsured. So we have a scaled down payment system for uninsured also, because of our love for the community, I actually would see a patient for free. However, we have certain regulations which require me to at least charge some money from them.
Sure. So, look, the Bronx, as far as I'm concerned, is the best borough in New York City. At the same time, it's widely known that there are some pretty significant health issues in the Bronx, ranging from asthma to hypertension to obesity. What do you see as the critical health issues that Essen is treating, and what do you see as the function of Essen in trying to stem the tide?
So you're absolutely right. We know that out of 62 counties, Bronx ranks 62nd. That is lowest in out of the whole New York State counties. At the same time, Bronx has amazing providers, amazing hospitals, amazing specialists. What we feel, and I feel personally, is that is the way the healthcare is delivered. So what most people in the Bronx lack is access to care when they need it. When they need to have access to primary care physician who can talk to them, or primary care provider. They need to be able to walk in when they have a problem. So that is why we have a huge network of primary care providers, and we have urgent care centers which are available 7 days a week. We are only closed probably only one day the whole year, but any of our patients can walk in anytime. And that is where I think we're going to change the way healthcare is delivered.
So it's a real community-based approach. It is uh, emphasizing access and ease of access to get folks in. What do you see as barriers to treatment? I remember we were doing some work in the Bronx with K through 12 students, and it was going great. Our goal was to promote, health and to promote academic achievement. But what we learned very quickly, not surprisingly, is that a lot of the parents spoke Spanish, and we had to have bilingual interventionists in order to really reach the families in a substantive way. What are the challenges that Essen faces in providing the great care that you provide?
I think you're right. We need to provide culturally appropriate care. Bronx is 60% Latinos, but also has a huge community of other ethnic background like African community, a Bengali community, Guyanese community. So the care has to be culturally appropriate. One of the biggest barriers that Bronx community faces is environmental and social determinants of health. We are one of the poorest congressional district. So that puts a huge burden on our community to, to not only to access care, but to keep themselves healthy. Food disparity, housing, transportation, all become barriers. So we in Essen Healthcare pride ourselves in a huge care management division. We have hundreds of care coordinators and social workers that help to overcome these social determinants of health, and which we call social impact team, along with amazing providers and specialists.
That's great. So let's and I think along those lines, something that I'm personally very excited about is the partnership between Essen Health, the upcoming partnership between Essen Health and Mercy College, where some of the docs at Essen will be enrolling at Mercy for an FMP. Can you talk about that for a minute?
Absolutely. But before that, I want to talk about what an amazing program Mercy and Essen are going to do. So as I mentioned, we are one of the poorest neighborhoods. Our employment rate was 5.4%, among the highest before COVID. And now we went as high as 25%. Now it's coming down to 15%. So we can see that we have a lot of poverty. poor neighborhoods. And we believe that we're going to change the community by education. When you educate the community, then you have a ripple effect on the generations beyond that. uh, People go up economic ladder through education. They can earn more. They can take care of the family better. So this program that we are launching with Mercy College is very much along the same program, where we have uh, healthcare disparity and shortage of healthcare providers. And we're going to train family nurse practitioners to work in the community, serve the community at the same time. Because we are a poor community and through Essen's relationship, they're going to get a federal loan waiver for their education.
Fantastic. And we are very much looking forward to that partnership. With the remaining moments we have, it's come to my attention that Essen, is it correct that Essen began as a small house on the concourse? How did Essen begin? What's the
Well,
story there?
I wanted to change the way healthcare is delivered. So I left my job at a local hospital and took over a small practice. And yes, it was a hole in the wall with a waiting room, with a where we used to put a bucket when it rained because the landlord hadn't taken care of it, and with an amazing staff that has stayed with me, Freddie, Teresa, Imelda, over the years. We really have transformed SN from a single provider into a close to 400 provider medical group serving the Bronx.
Fantastic. That's a great story. What year was that roughly when you started out?
1999 when we
Wow.
started.
Great. So you're about 22 years in. That's fantastic. So, you know, Sonny, you've given a lot to think about. If there was one message that you would give to the Bronx in terms of what Essen's doing to move health forward, what would it be?
We all need to stay healthy for our loved ones and for ourselves. So please take care of yourself. And if you have any needs, we are there to help you in our offices, urgent care center. And if you can't come there, we can do house call for senior homebound citizens at home. And we can help with the issues that cause barrier in care like housing, transportation, and food.
Fantastic. We're going to take a quick break. When we return, Dr. Sumir Sahgal will tell us a little bit about his personal life journey that led him to found an incredibly helpful and beneficial healthcare center and set of clinics in the Bronx. This is Public Health America. I'm your host, Dr. William Latimer.
If you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll at fcc.gov/broadbandbenefit or call toll-free at 833-511-0311. That's 833-511-0311.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. I'm so pleased to have Dr. Sumir Sunny Sahgal, founder and chief medical officer of Essen Health Care. Sunny, we've just chatted about Essen, which was so helpful and so informative, and the great work you're doing in the Bronx. The purpose of this second segment is to kind of just give our viewers a sense of the background of folks to kind of, our real goal is to get more high school grads to go to college and more just folks in the Bronx to go to college and chart a path and to figure out what challenges our guests faced and how they got past them to perhaps provide a life lesson or two that will help folks to get into and through college. So with that, Sunny, tell us, where were you born and what were some of your formative experiences?
So I was born in a small village in India, Punjab, but I grew up in the capital, New Delhi. And I went to medical school in Maulana Azad Medical College in New Delhi. After spending a couple of years in training there, I decided to come to United States for further education because of the amazing healthcare system.
That's great. When you went to med school in India, were your parents what motivated you to do that?
So India has an interesting system. You do a lot of what your parents tell you to do. So I had other siblings who had other profession, architect and engineer, and my mom said, you know what, I need you to take care of me when I get old. And I need you to go to medical school. So I said, okay, sure, Mom, I'll go to medical school. Plus, I had some interest, but I wish I could say that it was a lot of self-motivation. No, it was more like because of my mom, I went to medical school. Unfortunately, my mom passed away while I was in my first year of medical school. She had developed high blood pressure, and like many of our patients, she wasn't very compliant with her medicines. And one day she got very stressed due to some situation, and she had a cerebral bleed, and she dies 24 hours later in a hospital. So from that day, I've been very motivated about preventing diseases and healthy care of patients. So when I talk to my patients here and see them, they have high blood pressure and they're not taking their medications or their illness seriously, I tell them it's a silent killer. Don't let what happened to my mom happen to you. And I share my story, and people really understand where I come from, and actually they get motivated to take care of themselves.
Sure. And I'm sorry, and but still a very compelling story, and the fact that it informed what you do. I have a very similar experience with my paternal grandmother, but I will also say, though, I love the part of your mom saying, I want you to go to med school so you can take care of me. I have three daughters, and I think I haven't figured it out yet, but I think I'm going to try to get one MD, one attorney, and one mechanic. I don't know if it's going to work out, but that's my current goal. It'll probably change. Plus, I've got to talk it over with my wife. I think she'll probably view it differently. So you went to med school in India. When you immigrated to the U.S., did you do a residency here, or what was that transition like?
I actually trained in East New York, and this was in 90s. And if anybody remembers the 90s, it was tough time in East New York, also in the Bronx.
Yep.
I was on a visa, which required me to stay in underserved area for 2 years as a condition of staying in this country. Otherwise, I had to go back. And I spent my 2 years working in underserved area. and has become over 25 years. And I'm still working in an underserved poor neighborhood, and I love it.
Right. That's great. But did you do a residency here?
Yes, I did my residency for 3 years in internal medicine, and I worked a little bit in Queens. And then I got interested into what about healthcare system, and I actually put myself to school in the evenings at New York University Wagner School, and I ended up doing a master in health policy management. So I got to know the healthcare system much better than most doctors do, and that's what really made me realize that it's not the providers, it's not the hospital, it's not even the patient, it's the system which is not delivering what it's supposed to do. And that's why I got really motivated to change the way healthcare is delivered. So somewhere in 95, 96, 97, I moved to the Bronx. I joined Bronx, Lebanon. I became medical director of the Fulton division while I was doing my master's. And when I finished my master's in 99, I moved out of the hospital and took over the small practice on the Grand Concourse, which was a little hole in the wall. And we have changed it over a period of time. Now it's a 10,000 square foot building, and it's doing an amazing work for the community in that corner of the concourse.
There's an element of that story that I love. Well, there's several, but one I'll highlight for a moment is your education and looking into health services administration, because I think in some ways that is sort of the hidden gem of healthcare education, meaning that it obviously we need more FMPs, we need more MDs, we need more nurses, et cetera, PT, OT, PA, et cetera. But the Health Services Administration is what led you to see the systems issues that you wanted to address to make healthcare delivery more user-friendly in the community. Is that a fair summary?
Absolutely, Latimer. You're absolutely right. And 25 years later, I'm not young anymore, but still foolish enough to believe we can do a better job.
Well, I share both of those qualities and then some. Let's spend 30 seconds talking about a mutual friend, Dr. Alicia Georges, who in some ways brought us together and made us, to my benefit, very good friends. We're talking about a legend in nursing education and education in the Bronx. How did you get to know her, and what are your thoughts?
Dr. Alicia Georges is a legend. I have yet to see somebody as motivated and as energetic as her. She is just a force by herself. She was instrumental in helping me launch what is so dear to my heart, workforce development in the Bronx. We have foreign doctors who were working with me in my office before they went for training. But before they joined me, they were working as home attendant, they were working as taxi drivers, they were working in restaurants. And I met with Dr. Georges, and she convinced the president of Lehman College to start an accelerated nursing program for these doctors. Then they moved into nurse practitioner program. And thanks to her, we have graduated over 26 nurse practitioners and over 40 nurses from this program, just not from Lehman, but also from some other colleges.
That's great. A dear friend of mine and a dear friend of ours. So let me ask you this. We live in complicated times. Obviously the Bronx and New York City generally is incredibly diverse, and that's an enormous strength. Even in my 2 visits of Essen Health clinics, there was, very clear diversity in the PA, the MDs, the staff. But let's just be frank for a minute. What are some of the challenges that your international doctors face in sort of making their way in this country? Because we want, or I'll tip my hand, I want them to make their way. I want them to be a vibrant part of the Bronx to provide health to folks that need it. So what are some of the challenges that they face, and what can we do to address those challenges?
Latimer, you're so right. I think these foreign doctors face the same challenges as any immigrant does in this country. The worst time to come to this country is the first time, when you don't know how to shop, how to go to a bus stop, how to get the bus to stop, how to get into a subway and where to go. So those are the challenges they face, along with supporting the family. But the bigger challenge they face is, from a country they're coming with about 10 years of education and experience. They come to this country and none of that counts. They can't even touch a patient, let alone like where they were back home, operate or do some very helpful things to the patients and the community. So that's a general frustration they feel. And the healthcare system doesn't have a path, a clear path that is an easy path. The only path they have is like I did. You have to complete 3 exams, and if you score very well, you may get into a residency program, and you can spend 3 years doing it, and then you can practice. In New York State, 1 out of 3 doctors practicing is a foreigner, is from a foreign country, the foreign medical graduate.
Yep.
At the same time, the number of residency slots have gone down. So the opportunity is closing down, and these foreign doctors have very little job opportunities.
So, yeah, and I'm not hammering this home because of self-interest, but certainly what we're trying to do with Essen and Mercy is to address that problem to some degree. But certainly what you're saying is that maybe there could be some policy change that would provide greater flexibility for qualified doctors to provide the services that are so desperately needed in the Bronx. Is that fair?
Absolutely. I think the program that we are building with Mercy, where these foreign doctors can do a nursing program, which is can vary for about 2 years. And with SN, it's a work study program. They are working at the same time while they're taking care of the family, while they're studying. And thanks to Mercy and Monroe, they've created like a very flexible program for nursing. And Monroe has created a very flexible program that these nurses can become family nurse practitioner. And this program is not only going to be for foreign doctors, but will also be for regular RNs, where they can become nurse practitioner and actually take care of the patients in the community. So it's going to be the community taking care of itself, because these doctors, foreign doctors, are living in the Bronx, and this allows them an economic upward mobility. But more importantly, with a desperate shortage of providers in the community, so rampant during the COVID pandemic, we are now working to serve the community by bringing these very sought after providers into the Bronx, and creating jobs within the Bronx.
Outstanding. I want to thank Dr. Sumir Sahgal, founder and chief medical officer of Essen Health Care, for sharing some of his personal journey and also describing Essen Health Care. I'm your host, Dr. William Latimer. I'd like to thank you for tuning in. See you next time here on Public Health America.